you. Hi everybody, I'm so glad to be here. As Alex said, I'm Leah Clark. I'm a third year student in Economic and Social History, and I'm going to be speaking on mothers' negative experiences of childbirth from the post-war years, so from 1945 and through to the present day. And this is just an outline for today. We'll look at childbirth and how it moved from home births to hospital births. And we'll also look at a brief childbirth testimony from 1947 to give us an idea of what women were saying at the time. And we'll move on to more of the focus of today's talk with Professor Jane Cummings and her work with the 6 C's of patient care. And then we'll finally look at present day childbirth experiences and whether her work has been impactful or not. So the shift to hospital births. After the Second World War, we see a shift from predominantly home births to hospital births. So in 1946, we can see that 53.8% of births were happening in hospitals already, so over half. And we see a dramatic increase by 1970 to 96% of births happening in hospitals. This was largely due to improved sanitation and access to pain relief, and a lot of women were actually demanding or asking to give birth in hospitals due to this. However, with this change, we do see more intervention from medical professionals in this space. So it went from being a largely domestic kind of thing, giving birth when it was in the home. You were in your own home, so you had a lot of agency and control over that space. And it was also a very female-centred thing. Usually it would be midwives or mothers and friends that were there who shared that experience and had that understanding. Whereas in hospitals, it was mainly male obstetricians who would dominate these spaces, and it became very medicalised, and women began to see this lack of choice in their childbirth experiences. And this is where I argue that this lack of compassion came into childbirth experiences. So a childbirth testimony from 1947 from a woman called Brenda. She says that she had her first birth at home, but she then goes on to say, "It took 4 years before I could bring myself to have another baby. This time I went to a hospital, but it was more like a detention centre. I'm sure the ward sister or the ward manager hated mothers and babies. I was left alone in the labour room, and because I kept ringing the bell for someone to be with me, they took the bell away." And Brenda's testimony is just one of hundreds from this time, detailing the same reports of neglect and a lack of compassion. And it's because of testimonies like this that were so bravely shared that we do see changes in policy and strategies throughout the 20th and 21st centuries in attempts to place patients at the forefront of care and also to bring compassion in. And there are so many examples we could talk about, but for the sake of time, I'm going to focus on Professor Jane Cummings and her work with compassion. So who is Professor Jane Cummings? She is a registered midwife and nurse. She was previously Chief Nursing Officer for England and Executive Director at NHS England in the 2010s. She had executive oversight over maternity and patient experiences in England, and she took a focus on placing compassion at the heart of healthcare. And I thought she was important to talk about because she was a midwife, she was in the first-hand experiences of this. She went on to become an established academic and also extremely established in her role with a lot of influence in the NHS. But her focus was compassion. So this says to me that she saw a real need for this in healthcare generally and also maternity care. So she led the Compassion in Practice strategy, which was a 3-year vision and strategy for all nursing, midwifery and care staff. It began in 2012 and was expected to be fully implemented by 2015. And the main aims included providing a positive experience of care, promoting compassion, and overall aim to improve the patient experience and to ensure that every patient is treated compassionately and with dignity. And out of that strategy came the 6 C's of patient care for the NHS, and they are care, competence, communication, courage, commitment and compassion. And these are fundamentals for nursing and midwifery in the present day. They're supposed to be core values and expectations for all care staff, and if you're training to be a midwife or nurse, you do get trained in the 6 C's. And I also work for the NHS myself, not even in patient care, but I hear about the 6 C's all the time, so they definitely are known. But have they actually been impactful? Is compassion at the heart of maternity care in particular today? So present day experiences. In 2017, Leah McLaren writes for The Guardian with an article titled "I Can't Forget the Horror of My Son's Birth." She writes that despite medical advancements, childbirth is a major cause of PTSD and yet nobody talks about it. A 2020 Cambridge University study was titled "Women in England Had Predominantly Negative Experiences of Childbirth During the Pandemic," with 47%, so almost half of parents in a national survey reporting a negative experience of childbirth. This was largely due to poor communication, which caused anxiety And it was also compared to only 33% that reported a positive experience and 20% were neutral. And more recently, forgive me for using the Daily Mail, however, these women, Louise Perry and Ella Whalen, are authors and journalists, and their stories are still just so important to share, their personal and true testimonies of childbirth. And the article, so they shared their testimonies to the Daily Mail, and the article was called "The Stark Reality of Giving Birth on the NHS. From being told by a midwife, 'I can't believe you're still alive,' to getting rushed through a conveyor belt by uncaring staff who lacked kindness." So just to conclude, and just to put it really simply, I found that mothers in the 20th century were experiencing a lack of compassion in their maternity care and during childbirth. And despite attempts to place compassion at the heart of maternity care, women in the present day are still reporting this lack of compassion and negative and traumatic birthing experiences. And when I look at all this, it just leads me to question, why is this happening? And honestly, I don't have all the answers, although I wish I did. But here are some of the things that I've considered. Is it due to a lack of NHS funding? We know that the NHS is slowly becoming increasingly more underfunded, and with that, more chaotic working environments. Are hospitals and workplaces so chaotic that staff don't actually feel like they have the environment to provide the care that they want to because they're so stressed? Or is it due to a wider context of ingrained prejudices within society around women and female healthcare? I'm not sure, but I don't think that all hope is lost. I think there are things that we can all do to tackle this issue. So we can write letters to local MSPs and policymakers related to NHS care. We can take this evidence and say, look, the policies and strategies aren't working. There's still a problem here. Too many women in the UK are having negative experiences of childbirth. What can we do about it? We could also volunteer our time for women's charities. There's Glasgow's Women's Centre in Maryhill, and I also just learned of a charity called AMA, where you can be a companion in the birthing room for someone who doesn't have someone to be with them or maybe can't communicate. And also we can support the new and expectant mothers in our own lives, reaching out in any way that we can. Thanks for listening.